Africa is home to some of the world's richest natural resources. Sitting on a treasure trove of untapped potential, Africa has over 30% of the world's mineral reserves. No wonder Africa has been seen as the future of global supply chains.
But it's not just about the minerals. Africa's fertile land makes it the perfect place to cultivate a variety of crops, everything from cocoa, coffee and tea to cassava, maize and legumes. It's a market that feeds billions and offers huge growth potential for investors looking at the future of food security and agribusiness. By the way, my name is Hawa and I represent the western part of Africa.
And that's just the start. Africa's energy sector is rapidly evolving with abundant natural resources like solar, wind, and hydropower. The continent is positioned to become a global leader in renewable energy. Countries like South Africa, Egypt, and Kenya are already making significant strides towards energy independence and sustainability.
Don't even get me started about what makes Africa stand out. Of course, it's its people, the young, dynamic, and entrepreneurial spirit that is fueling the rise of technology and innovation. We are seeing incredible growth in sectors like fintech, e-commerce, and mobile technology. The continent's digital transformation is creating new opportunities for businesses and investors, and the pace is only accelerating.
Discussing trends, challenges, and opportunities available in Africa is what we discuss on Invest Africa Podcast.
Invest Africa Podcast.
You are Africans. We are Africans. Louder. We are Africans. Louder. We are Africans. Come on, Africans. Yeah. We are Africans. I can't hear you. We are Africans. Louder. We are Africans. Come on, Africans.
So whether you are a seasoned investor or someone looking to explore the emerging markets, the Invest Africa podcast is here to help you navigate this exciting landscape. Join us as we take you on a journey through Africa's abundant resources, thriving industries, and the game-changing investments that are shaping the future of the continent.
The Invest Africa Podcast, shaping Africa's investment landscape.
Happy New Year, everyone, and welcome back to the Invest Africa Group podcast. This is a podcast where we explore the challenges, opportunities, stories, shaping investments across our beautiful continent, Africa. I'm Hawa Adegite, and I can't think of a better way to start 2025 than with all of you joining us for this exciting journey. And like always, I have with me my ever delectable co-host, Mubarak Abimbola. Hi Mubarak, how are you today?
Hello, Hawa. It's a beautiful new year. And like you rightly said, my name is Mubarak. It's a brand new year, and with it comes new conversations about how to invest in Africa's future. Hawa, before we dive into today's topic, let's just take a moment to look back at our last episode. It was such a fun one. I remember we talked about a safari destinations in Africa. Do you want to shed some light about that?
Yeah, it really was an interesting episode. During the last episode, we talked about some incredible safari spots like Barak has rightly mentioned. We talked about 10 spots which we researched across Africa, and these spots are not just breathtaking, they are also investment gold mines for ecotourism. We shared tips for investors looking to dive into this booming industry, and we also highlighted how eco-conscious travel can empower communities and protect the environment. Honestly, if you missed it, go back and listen. It's a perfect guide for anyone thinking about ecotourism in Africa.
Yeah, absolutely. Well, this week, let's shift gears a little bit. We'll be shifting gears to a topic that it's even closer to home. Yes, we're talking about health innovation as a gateway to impactful investment. This is one of those topics that is not just relevant, it is transformative. Every time we get to hear health is wealth.
Yeah, exactly. Today, we are exploring how health innovations are shaping the future of Africa, We'll start by discussing why this sector is so important, not just for improving healthcare, but also as a key driver for economic growth and investment opportunities.
Yes, we would also dive into some fascinating examples. We'll talk about how Ghana's ongoing malaria elimination efforts are nothing short of inspiring. We'll look at how innovations is playing a key role there. On the flip side, we'll also explore how Egypt achieved its malaria-free status and what lessons other African countries can learn from their journey.
And most interestingly, we'll also be talking about the biggest trends in health innovations, like telemedicine, which is revolutionizing access to healthcare. We'll be looking at artificial intelligence in diagnosis and even blockchain for secure patient data. This is where technology meets healthcare to create real impact.
And of course, we'll break down why health is one of the smartest sectors to invest in right now. And talking about investment, did you know that Africa's healthcare market is growing so fast? With spending expected to reach $259 billion by 2030, that is in the next 5 years, Africa's health market is expected to reach about $259 billion. For investors, whether local or in the diaspora, this is an opportunity to combine financial returns with social impact.
We'll not just be sharing all of these insights. Like always, we'll be leaving you with actionable plans and strategies on how to actually get involved. From funding health startups to supporting grassroots healthcare initiatives, there's something for everyone in this conversation. So Mubarak, are you ready to kick this off?
Yes, I'm more than ready, Yawa, because this is such an exciting way to start the year. So if you're as curious and energized as we are, stay tuned, for we're about to dive into the world of health, innovation, and impactful investment.
Yeah, so let's do this. This is Invest Africa Group Podcast, and we're here to show you how innovation in healthcare is changing lives and building fortunes across the continent. So let's dive right into the heart of today's topic, healthcare in Africa. Mubarak, it's no secret that Africa's healthcare system has faced immense challenges over the years. But there's a lot to unpack when we look at where things stand today.
Well, absolutely, Yawa. Africa's healthcare landscape is like a coin with two sides. On one side, we have significant challenges, and on the other, we have incredible opportunities for growth and innovation. So what do we do? Let's start with the challenges, because they highlight why innovation and investment in healthcare are so critical.
Yeah, talking about challenges, first off, access to healthcare still remains a major issue across Africa. According to the World Health Organization, the WHO, Africa has about 24% of the global disease burden, but only 2% of the world's healthcare workers and less than 1% of global health expenditure. That imbalance is staggering. It is worthy to note that Africa has a significant shortage of healthcare professionals, including doctors, nurses, specialists, and even auxiliary healthcare workers. This shortage is so much by the migration of healthcare I didn't have to pronounce that word, so I didn't say.
Exacerbated.
Exacerbated. It is worsened. Yeah, it's worsened. So let me take it back. Okay. This shortage is actually worsened by the migration of health professionals to other regions. We've been seeing the burden of the brain drain that actually hit Africa for more than 10 years. I think the COVID era actually increased the brain drain issue in Africa, and this has reduced the already limited supply of trained personnel. As a result, healthcare facilities are often overcrowded and patients may experience delays in receiving care.
Yes, I agree with you. The COVID-19 exposed Africa as a continent because because there was a shortage of healthcare personnel in the other part of the world. So other continents had to poach Africa's health workers, and it is what it is at the moment. So it is also worthy to note that Africa accounts for more than half of the global deaths caused by communicable and non-communicable diseases. Diseases such as malaria, tuberculosis, HIV/AIDS, and neglected tropical diseases continues to affect millions. Take, for example, our
In 2022, malaria alone caused over 600,000 deaths in Africa, making it one of the continent's leading health challenges. At the same time, the rise of non-communicable diseases, NCDs like diabetes, hypertension, and cancer is increasing rapidly, putting further strain on an already overburdened healthcare system.
I think to say that again, taking further strain, the way you said it sounds, did you get that? I didn't get that.
At the same time, the rise of non-communicable diseases like diabetes, hypertension, and cancer is increasing rapidly, putting further strains on an already overburdened healthcare system.
Absolutely, Mubarak. And then there's the issue of infrastructure. According to the African Development Bank, about 60% of Africans lack access to essential health services. Rural areas are particularly underserved, with many communities living miles away from the nearest health facilities. The shortage of medical equipment, electricity, poor road network especially, clean water, and even adequate sanitation facilities hampers the quality of healthcare services. I was traveling to a rural community in West Africa, some time ago, and a pregnant man was in the bus while we were going, and he made a statement that, this bad day, she's already having, what's the word now? Threatened abortion because her baby is kicking heavily and all of that. And this is not a joke actually, it is the reality of many regions in Africa.
While infrastructure has always been a major problem in the African continent, I think we should not forget about funding too. Africa's healthcare system are chronically underfunded. On average, African countries allocate just 5% of their GDPs to healthcare. This is far below the 15% target set by the Abuja Declaration. And funny enough, ironically, the Abuja Declaration, which was signed in Nigeria, and for more than 20 years, Nigeria has budgeted less than 5% of its annual budget to health. In fact, in the 2025 budget, about 2.48 trillion naira was appropriated for health, amounting to about 5.18% of the 2025 budget. I mean, this gets you wondering if a particular declaration, if particular agreement was signed in a country that 15% of the annual budget will be dedicated to health. Yet that country is the one flouting the agreement, positioning about 5% or less than 5% of the budget to health. Isn't that worthy of note? The lack of financial resources limits the ability to build and maintain healthcare infrastructure, train staff, and procure essential medicines. Most times, here in Africa, we rely on donor fundings to fill the gap, which is quite unreliable and sometimes short-term.
Thank God you mentioned the issue of budget allocation, because the big elephant in the room is the weak governance and poor management structure across Africa, and this has resulted in inefficiency, waste, and lack of accountability, which has ultimately hindered the effectiveness of healthcare delivery. So you mentioned 2.48 trillion naira as being budgeted for healthcare. That is quite a lot if you look at it holistically. It's quite a lot. But how was this money managed? Did it get to the core places that it ought to get to? Was it not siphoned for personal gain, right? Moreover, national health policies and priorities are often fragmented, which has made it difficult to implement consistent improvement across Africa.
Yeah, to wrap this up, to wrap the challenges up, Africa has one of the fastest growing population in the world, with a significant youth bulge. If you look at the demograph, Africa has more of a younger generation, younger category of the demography. You realize that the population is growing so fast. Rapid urbanization is also placing additional strains on cities and healthcare systems. The demand for healthcare services is rising exponentially. It's still the same health centers we've had for the past 10 years, still the same number we have till now, and we have a daily increase of births.
And this gets to make you question, what is the government doing about it? So the demand for healthcare services is rising exponentially, and many governments are struggling to keep up with the growth of both the population and the urban centers. Lack of planning and putting up effective system has been great disadvantage for the health sector.
Yes, we've been able to highlight some disadvantages. Yes,
The challenges.
Yeah. We've been able to highlight some challenges affecting the healthcare system in Africa. Like we always say, we highlight these challenges not for you to get discouraged, but for you to be able to. It's more like we're putting forth the problem statement and we'll be discussing solutions. So, having discussed the challenges, let's talk about some of the observed gaps in Africa healthcare system. Like we mentioned earlier, we are not where we started from. Obviously, there has been progress and improvement over the years. You might be wondering why we have to discuss observable gaps. Smart investors know that for every identified loophole, there's an opportunity for investment. Access to affordable health insurance remains a major gap. While some countries have made progress in expanding coverage, the majority of Africans remain uninsured or underinsured. You get to some places in Africa, people don't even know what healthcare insurance means. This means that many people must pay out of pocket for healthcare services, leading to unplanned and catastrophic health expenditures and barriers to care.
I was still talking about insurance here. If not because you work with a particular organization, would you have an health insurance?
No.
That's the problem. That's the problem.
I started working.
Imagine. So talking about insurance, there's something that is also as important as insurance, and that is data. Unfortunately, we cannot say that this is the number of people that are insured in Africa. So data is necessary. Many African countries still lack robust health information system. Accurate and timely data is essential for making informed health policy decisions, tracking disease outbreaks, and monitoring healthcare outcomes. The absence of such system leads to inefficient resource allocation, and it hinders effective intervention. So if you're thinking what I'm thinking right now, you know what to do. Data is important as much as insurance.
Yes, but you mentioned earlier the impact of urbanization in healthcare delivery. And that is one thing that has always presented a divide in healthcare access. The rural-urban divide is one of the most significant gaps. Rural areas often face the most severe shortages of healthcare providers, services, and especially infrastructure, like we mentioned earlier. This disparity leaves millions of people in rural regions without proper medical care. And a lot of times you see that they are compelled to travel long distance for basic healthcare services. So this is a gap. So taking your investment to the rural area is most definitely a smart investment.
And talking about rural-urban divide here, another gap I've been able to observe in the health sector of Africa is the maternal and child health outcomes in Africa. Africa is among the worst continents whenever we are talking about the maternal and child health outcome. High maternal mortality rate, inadequate prenatal care, lack of skilled birth attendants has continued to plague many African countries. Infant mortality is also a major concern, with factors such as malnutrition, lack of immunization, poor sanitation. All these have contributed to a high rate of infant mortality as well. So maternal and child outcome is also a gap that you might be hoping to fill. What are the solutions? How do you intend to fill this gap? We'll keep you updated later on the podcast.
Yes, finally, Mubarak, you mentioned earlier the rise in non-communicable diseases, and it is quite unfortunate that Africa's healthcare system is ill-prepared to manage chronic conditions. We are still dealing with issues like malnutrition, poor sanitation, lack of immunization, things that, proper prevention can actually help us curb. And now we have to deal with chronic conditions. There's a lack of specialized care for NCDs. NCDs now, like heart diseases, cancer, diabetes, and there's growing prevalence as well. And this has required urgent attention from previous years, both from government and the private sectors. From Barak, here's the good news: there has been progress. For one, life expectancy across Africa has risen by nearly 10 years in the last 2 decades, going from 46 years in 2000 to 56 years in 2020. That's a significant improvement in Barak. Don't you think so?
Absolutely, absolutely. There has also been progress in the fight against major diseases. For example, HIV/AIDS related deaths, they've declined by 43% since 2010. I mean, 43% is a huge number. I mean, we need to give it to African government on that. Thanks to better access to antiretroviral therapy and our awareness campaign. And also, speaking of diseases and the progress we've been able to make on the continent so far, malaria. We are now seeing some countries like Ghana leading innovative campaigns to eliminate malaria altogether.
Yes, talking about campaigns, like you said, we need to give kudos to non-governmental organizations as well as government as in raising awareness about HIV, tuberculosis and malaria especially. If you could remember, sometimes in the early 2000s, there were a lot of sitcoms, a lot of TV shows about HIV, stigmatization and the like, and this has actually helped to curb the disease.
What comes to mind at the moment? Our one of the sitcoms we watched while we were growing up that comes to mind at the moment is the MTV Sugar. Do you remember? Yeah. Did you watch that? Did you remember? Did you watch that sitcom? Yeah. So yeah, that's a great show.
I think there was Sugar Nigeria, Sugar Ghana.
Yes. There was Sugar South Africa too.
Helpful, yeah, it's really helpful. Yes, and that leads us to another sign of progress, which is the rise in mobile health solutions. Did you know that mobile phones are now used to provide healthcare services to over 60% of populations in some African countries? Apps like Baby in Rwanda and Hello Doctor in South Africa are actually creating significant revolutionization on how people access health advice and services.
Also, Africa is now home to some of the most innovative health startups in the world. Companies like Zipline, which uses drone to deliver medical supplies to remote areas, are showing us what is possible when technology meets healthcare. In Nigeria, we now have startups like Dr. 247, Iwelu, amongst others, that prefer health solution for as low as $2. Our $2.
I mean, just imagine, it's no more an imagination. There's evidence for it now. You can just sit, you're having some kind of symptoms, please basic symptoms now. Don't go and start googling some chronic issues that you've already been diagnosed with. But imagine you're having some symptoms and you can just pick your phone and text somebody that you are sure will give you the right information. We are living in the good times in Barak. So let's leave them with some current data and trends shaping healthcare in Africa today. For starters, Africa's healthcare market is projected to grow to $259 billion by 2030. For starters, Africa's healthcare market is projected to grow to $259 billion by 2030. I think Mubarak mentioned this earlier, and this has been driven by a rising youth population and an increasing demand for better healthcare services.
Yeah, well, that's quite huge. And with over 70% of Africans under the age of 30, there's also a growing demand for digital health solutions. Telemedicine, for example, is booming with platforms like Nigeria's Life Bank and Kenya's M-Daktari connecting patients to doctors in real time.
Another thing to watch is the role of public-private partnerships in healthcare delivery. In 2023, the African Union launched the Africa CDC Saving Lives and Livelihood Program, which aims to vaccinate millions and strengthen healthcare infrastructure across the continent. And that is just one example. Yeah, there's a high proliferation of CSR, corporate social responsibility, geared towards the healthcare, trying to curb malnutrition, immunization, access to vaccination, and the like. You can go ahead.
And also, let's talk about financing innovation. Yeah, I remembered we mentioned that funding has been a problem, has been a challenge in the Africa's health sector. But it is also worthy of note to state that Africa has seen a surge in funding for health startups, with over $1 billion raised in the last 5 years. Investors are increasingly recognizing the potential of health tech to address the continent's unique challenges.
So all of this points to one thing, but while there are significant challenges, there's also an incredible opportunity to transform healthcare in Africa. But this transformation obviously requires innovation, collaboration, and of course, investment.
Exactly, Yawa. Health is wealth, as the saying goes. And investing in healthcare isn't just about financial returns. It's about improving lives, building stronger communities, and creating a healthier and more prosperous Africa.
Now that we've laid out the broader picture of healthcare in Africa, it's time to zoom in on two incredible case studies. Ghana, firstly, that has been fighting to eliminate malaria, and Egypt current status as a malaria-free nation. This story shows us how innovation, collaboration, and investment can truly reshape healthcare outcomes.
Yes, that's right. Our malaria has long been one of Africa's most significant health challenges. It accounts for 94% of global malaria cases and deaths, and with children under the age of 5 being the most vulnerable. I mean, it's quite sad that for years now, Africa has always been the major contributor of malaria cases and deaths. 94%, that's a huge number, you would say. But what's remarkable from all these cases is that countries like Ghana and Egypt, they are rewriting these narratives. So let's start with Ghana.
Yes, Ghana is actually making major strides in its malaria elimination efforts, and innovation is at the heart of this. According to 2023 data from the National Malaria Control Program, malaria prevalence in Ghana has dropped from a staggering 27% in 2014 to 8% in 2022. That's an incredible achievement to this.
Absolutely. One of the key strategies the country used has been the rollout of rapid diagnostic tests (RDTs) and the distribution of insecticide-treated mosquito nets (ITNs). But one thing I must say about the distribution of insecticide-treated mosquito nets is that while Nigeria has also been rolling out insecticide-treated mosquito net, we are not near anywhere eradicating malaria in the country. In fact, it's quite sad that even if government and non-governmental organizations roll out all these treated mosquito nets, some people still resell. And makes me wonder, what is Ghana doing differently or what makes Ghanaians different from Nigerians? In 2022 alone, I must say, over 15 million insecticide-treated mosquito nets were distributed across Ghana. But here's where it even gets more interesting. Technology is also helping Ghana play a huge role in eradicating malaria.
Exactly, but you said it all. Technology is at the forefront of Ghana's progress compared to Nigeria. Apart from the large population in Nigeria compared to Ghana has partnered with innovative organizations like Zipline to deliver life-saving malaria treatments to remote and underserved areas using drones. These drones can deliver essential medical supplies in less than 30 minutes to areas that would otherwise take hours to reach by road. And that's been a game changer for them.
Let's not forget about digital health platforms like M-Pharma, which are improving access to affordable medications. Through partnerships with local pharmacies, M-Pharma ensure that anti-malaria drugs are available where they are needed the most. These kinds of tech-driven solutions are making real differences. M-Pharma would partner with local centers. They would know, okay, this is the available anti-malaria drugs that is in need currently, and they will make sure that they are delivered. But this is because data is important. important they have better data, or they have enough data to know that, okay, at this particular location, at this particular area, certain number of people need anti-malarial drugs, and M-Pharma is making it possible to ensure that these people, they have anti-malarial drugs when they need it the most.
Yes, data, that's like the keyword. Data, gotta make sure that they use the available data and try to get more healthcare data to track malaria cases in real time, and which is a noteworthy initiative for them. By leveraging mobile technology and health data, the government identified hotspots and they were able to allocate resources more effectively. It's a proof that data-driven decision making can save lives.
Yeah, before I even step away from the conversation of data, I mean, I still wonder, probably because of the government's willpower to eradicate malaria. Because you realize that there was a particular time in Nigeria, the Nigeria Center for Disease Control and Prevention, NCDC, they were also coming up with real data of people infected with COVID-19. So it now begs you to ask the question: if we can have real data of people with COVID-19, why can't Nigeria also have data of people with malaria? Real-time data. I mean, we did it with COVID-19. We are doing it with cholera at the moment. We are doing it with Lassa fever. NCDC would always come up with a data with updated information every single day of the total number of people currently suffering, their locality, where they are being ostracized, or where they are being isolated. I mean, it's impressive that it is impressive to see Ghana's progress here. Although there still works to be done, though. Achieving malaria elimination requires sustained funding, innovative solution, and collaboration between government, the private sectors, and international partners. And that is where investment comes in. There's a real opportunity here for investors to support and scale those initiatives.
About the data policy is across Africa, but using it in Nigerian context now, it really draws on implementation. If you check the national healthcare policy, there are different clauses for healthcare, collecting healthcare data across all, both government, private, and federal healthcare centers. At every point, at every contact with the healthcare system, your data has to be taken and collected. But are these being implemented? Implementation has always been an issue at every point, and this is where we always task the government. We don't just put out these policies and expect that the people are complying with it. We need to keep track on how these policies are being implemented and to be able to use the data. I mean, if a particular government hospital knows that the government will make use of the data coming out of their hospital, maybe regularly, monthly, biannually, something like that, they'll definitely bring out good stuff. And that is what has worked in other African countries, like we've seen. Now let's shift our focus to Egypt. Egypt is one of the few African countries that achieved a malaria-free status. A certification was granted to them by the WHO in 2016. That is almost 10 years ago, and this is a remarkable achievement, especially considering that the country used to face significant malaria outbreaks. And like you said, that begs the question: how did they do it?
Now, before I even go to Egypt's success stories, I think I need to mention the fact that even after providing solutions, after eradicating malaria, sustainability is quite important for governmental and non-governmental organizations to ensure that for every success that is achieved, you can always implement on this success achieved to continue to have that status. Well, even though the World Health Organization certified Egypt as malaria-free in 2016,
In 2018, they lost the malaria-free status again, and the government, having realized that all our efforts in eradicating malaria is about to go to waste, they came up with different strategies again, and they made sure that they got the malaria-free status certification again in 2023, October 2023 to be precise. The World Health Organization again gave Egypt the malaria-free status certification. So I hope this time around Egypt will be able to maintain that stride and they would not lose that certification again. So Egypt's success story boils down to three things. I think I mentioned it earlier. One, strong political commitment. The willingness of the people in government will determine whether there will be success in the healthcare sector or not. Strong political commitment is one of the pillars of Egypt's success story. Also, robust public health infrastructures. You cannot exclude that from the whole conversation. And finally, innovative interventions. For example, when I was talking about the strong political commitment, the Egyptian government invested heavily in early diagnosis and treatment programs, ensuring that malaria cases were detected and treated quickly before they could spread.
And they did not do it alone. Like we mentioned earlier, public-private partnerships have worked, and this is another evidence. Egypt worked closely with international organizations like the WHO and the Global Fund to fight AIDS, HIV, tuberculosis, and malaria. These partnerships provided the funding and technical expertise needed to implement large-scale malaria eradication programs in Egypt.
Yeah, another critical factor was community engagement. Health officials in Egypt worked directly with local communities to raise awareness about malaria prevention and treatment. They also distributed long-lasting insecticide-treated nets, introduced door residual spraying to control mosquito populations. All these things, they look residual. All the strategies being implemented, they look residual, but they were able to solve the problem. I think engaging community engagement in local language has also helped Egypt in achieving the malaria-free status they have today. So other African countries can also emulate these strategies.
Yes. What's also inspiring about Egypt's story is that it shows malaria elimination is possible, even in a resource-constrained setting. It's a blueprint for other African countries to follow, and it highlights the importance of sustained investment in healthcare systems. Like Mubarak mentioned, these solutions might seem residual, however, they work. Speaking about community engagement, now why these initiatives by Egypt actually worked is because there was usage of the solutions, and that is where community engagement always comes in. You cannot just offer solutions to the people without involving them in planning for the solution. That way, they are able to accept it because, you took it to them at the beginning, they agreed on what should be done, then you did it their way. Of course, it only takes to them to actually make use of those solutions, and that is one way that Egypt was able to attain a malaria-free country.
Yeah, exactly. I agree with you. Although while Egypt may no longer be dealing with malaria, I think one thing they've continued to do that I love so much is that they've continued to innovate in other areas of healthcare. For example, the country is investing heavily in telemedicine and health tech startups, making healthcare more accessible to its population of about 100 million people. The ripple effects of a strong healthcare system, they are very endless. When people are healthy, when the healthcare system is strong, you would always see it would always create room for further development.
That's okay. So Mubarak, let's switch gears a bit and talk about some of the broader trends we are seeing in health innovation across Africa. We touched a few earlier, but let's dive a little deeper because this is where the real investment opportunities lie.
Yeah, great idea. One of the most exciting trends in the continent at the moment is telemedicine. Platforms like Live Bank in Nigeria, they are not only connecting patients with doctors remotely, but they are also solving logistical challenges like blood shortage. Life Bank, for instance, uses motorcycles and drones to deliver blood to hospitals in emergencies.
Yes, and there's also the AI-powered diagnosis tools. Companies like 54 Gene, based in Nigeria, are using genomics research to address the continent's unique health challenges. By analyzing genetic data, they are developing personalized healthcare solutions and contributions to global research on diseases that actually affect Africans. AI-powered diagnosis tools, companies like 54 Gene, based in Nigeria, are using genomics research to address the continent's unique health challenges. Like we said, this is a people-driven solution. You are looking at the main challenges that are affecting a particular set of people. Through analyzing genetic data, these companies are developing personalized healthcare solutions and contributions to global research on diseases that disproportionately affect Africans.
Yeah. Another game changer on the continent is the blockchain. In Kenya, for example, blockchain is being used to secure patient record and ensure the authenticity of medical supplies. This is not only improving the trust in the healthcare system, but it is also reducing issues like counterfeit drugs. And I need to speak elaborately on this particular issue of counterfeiting. Counterfeit product is now on the rise on the continent, from drugs to food to drinks and to household items. Counterfeit is like the order of the day on the continent at the moment. But Kenya has been able to reduce that through the use of blockchain technology. Now, for every product that is being produced for the healthcare sector, there's a way you can ensure the authenticity using the blockchain. There's a record on the blockchain where you have to put details of that product on a secured network where people can easily access it and see for themselves that, this product I'm about to buy, it is trusted and everything is correct. And also data, talking about data for patient record. Imagine in Nigeria, the paper record is still being used. I mean, it scares me a lot every time I go to do investigative reports on the one of the biggest health facility in Nigeria, the University College Hospital, and I still see patients carrying paper files all about. I keep wondering what would happen if at any point there's a logistic error, there's a detail get missing or one file get missing as a result of miscommunication or the other. What happens? So it's either they have to start the process all again, or there's a miscommunication of treatment. There's a mistreatment along the way. So it makes me wonder how far we still have to go in Nigeria. If countries like Kenya, they've adopted the use of blockchain technology to solve this particular problem.
That's a quite impressive progress. Another area gaining traction is mobile health, or health, like it's popularly called. Apps like Hello Doctor in South Africa are providing health tips, symptom checkers, and even emergency response services. Also, a simple smartphone app. Given that mobile phone penetration in Africa is over 80% already, this is a powerful way to reach millions of people.
Well, these innovations don't just improve healthcare, they also create investment opportunities, with Africa's healthcare market projected to hit $259 billion by 2030. Now is the time for investors to get involved, whether it is funding health startups or investing in infrastructure or supporting public-private partnership. There's so much potential here.
Yes, Mubarak. All right, we've covered the current status of healthcare in Africa. We've explored inspiring success stories from Ghana and Egypt, and we've also highlighted some cutting-edge innovations. But now it's time for the real talk business, investment opportunities in Africa's healthcare sector. Where should investors be looking, and how can they get started?
That's like the biggest question. The healthcare sector in Africa is ripe for investment, and the opportunities are as diverse as the challenges the continent face. Let's break it down into key areas where investors can have both impact and social returns. solutions?
Okay, first off, I'll be talking about digital health and telemedicine. If you've been listening to us, we've mentioned this a couple of times. This is one of the fastest growing areas in healthcare innovation, and for good reason. Africa's mobile phone penetration rate is over 60%, and many countries are leapfrogging traditional infrastructure challenges with technology.
Yeah, exactly. Companies like Bebil in Rwanda and M. Daktari in Kenya are connecting patients with doctors through mobile platforms, reducing the burden on physical healthcare facilities. Investors can explore funding for similar startups or scaling existing ones across multiple.
And let's not forget about mobile apps that provide preventive care and health education. I mean, wherever there's a preventive solution, there's education, then half of the problem has been covered already, because we are talking prevention, that means we are talking eradication. Like Hello Doctor and other health are helping people manage chronic illnesses, providing access to health information, and you can even get emergency support. With African youth population growing, there's huge potential for these services to grow as well.
In a bit to simplify all the technological jargons we said, what we are saying is that having a health startup, whether by providing, whether by solving the problem of data or solving the problem of connecting a doctor to a patient, you can never run at loss, because that's Africa's population, the youth population. It's a way for you to tap in. Now, moving on, another area with massive potential is pharmaceutical manufacturing and distribution. Africa currently imports about 70 to 90% of its pharmaceutical products. This dependency on import not only drives up costs, but also creates vulnerabilities during global supply chain disruption. I hate to create what do they call it?
Bias?
No, it's not even bias here. There's this thing I want to remember. I hate to create a conspiracy theory. I hate to create a conspiracy theory. You know, there was a particular time when COVID was at its peak. A particular rumor went viral that the only reason why COVID-19 even broke out in the first instance was because of a new drug that was to be sold. I mean, if there's no dependency on the global supply chain for drugs, probably Africa's health solution might not be dependent on many of the health challenges that are being imported into the continent as well. It's just a conspiracy theory, by the way.
Okay, let me give an example on this issue of dependency on pharmaceutical products, on imports of pharmaceutical products. If you go to the pharmacy today and you want to buy a drug, they are going to bring out about 4 different variants of that drug, and they say, oh, this is from Germany, this is a Swiss product, this is a Nigerian product of the same kind of drug that you want to buy. Of course, there will be a difference in name, but I mean, the chemical composition of this product is like the same, but different manufacturers. And in all cases, in most cases, the Nigerian product is most expensive, and those from other countries are quite cheaper. However, based on reviews, the product from other countries seems to be more effective. And you know, it keeps people wondering what exactly is the issue with imported drugs, and that is where this investment opportunity comes into play. Investors can explore opportunities to establish or fund local pharmaceutical companies to produce essential drugs, vaccines, and medical supplies. For example, Aspen Pharmacare in South Africa has shown how successful localized production can be, especially in producing COVID-19 vaccines. Taking an example,
Yeah, with the implementation of the African Continental Free Trade Area, AFCFTA, there's also an opportunity to create regional pharmaceutical hubs. Imagine manufacturing facilities in Ghana, serving West Africa, on Kenya, supplying East Africa with affordable, high-quality drugs.
Yes. Now let's talk about infrastructure. As mentioned earlier, many African countries lack adequate healthcare facilities, and this therefore opens up opportunities for investors to build or to renovate hospitals, clinics, diagnostic labs, and even specialized care centers like cancer or maternity units. You might think that people don't have the money in Africa to use these facilities, but you'll be shocked. Like when it comes to healthcare, health is wealth. People have to you see people doing GoFundMe, trying to get the best healthcare service that is possible for them to get, and it is in their country. I mean, anybody will pay for it. So this is a major investment aspect in the healthcare service delivery.
And here's the thing, public-private partnership can also play a big role here. Governments across Africa are increasingly open to working with private investors to improve healthcare infrastructure. For example, the Clinics Healthcare Group in South Africa operates private hospitals that cater to the middle income population. This model could be replicated in other regions as well.
Yes, Mubarak. One of the biggest barriers to accessing healthcare in Africa is affordability. Like I mentioned earlier, investment in infrastructure could be scary, especially for investors, because of the level of out-of-pocket payments and the global burden of poverty in Africa. So this creates an opportunity for investment in innovative health financing models. If you could think of solutions that could help, with payment for health services like micro-insurance or pay-as-you-go services, I think that is a very good investment area as well.
Absolutely. Our companies like MTBAR in Kenya are using mobile money platforms to enable low-income households to save for healthcare expenses and access insurance. Investors can support models to expand access to affordable healthcare while also tapping into growing markets. I mean, we have so many fintech companies that can replicate the idea of MTBAR. You can just look up for one that already have this model in place, and you can help upskill them for a slice of the pie.
Yes, and let's not forget about a very interesting one, which is the diaspora investor. This is the first time I'm actually coming across this particular concept. The African diaspora spent over $50 billion in remittances back to the continent this year. So there are platforms that enables people in the diaspora to invest in health insurance for their families or communities in Africa. And that is another exciting opportunity. Imagine you don't have to be bothered about, your family members in Africa having to go through problems when they need health services, especially when it comes to financing. You could actually plan ahead for them, and you really don't sending the money to Africa. They don't have to bother out of their own little money. So I mean, that's a place that we need to create more awareness about and invest more in it. So there should be high rate of those. Is it high rate? There should be an increased number of such platforms, increased awareness for people to know that they can actually create health insurance structures for their families or community members in Africa, basically.
I mean, that would be quite an interesting one. Imagine your sibling in the United Kingdom paying for your health insurance in Alagbado and creating a platform. Creating a platform that can ensure that investments in healthcare covers people living in Alagbado area. That means people in Alagbado area do not have to pay directly from their pocket, because a group of people that came out from Alagbado that are currently living in any of the outside the country, outside the continent, can invest into Alagbado healthcare system, and that will cover the health issue of Alagbado system. I mean, that's quite an interesting one. I've always known that the African diaspora sends a lot of money in terms of remittances. For those that might be wondering where the data came from, even using Nigeria alone, you'd see that one of the things the federal government of Nigeria, one of their biggest revenue in 2023 was investment, was money being sent from diaspora. It's called diaspora remittances, and that was a great number. We saw a rise in the number of diaspora remittances the country has had. The highest Nigeria has ever had in history was in 2024. So, I mean, they are hoping they can also increase on that. So we can also explore that particular sector opportunity, diaspora remittances, to cover a particular community, and I'm looking forward to making that happen one day, though. And moving forward, another place you can invest in is medical equipment and technology. This cannot be overstated. Many healthcare facilities in Africa still lack basic equipment like diagnostic tools, imaging machine, and surgical instruments. Investor can explore partnership with manufacturers or even leasing models to supply equipment to hospitals. I mean, it creates an opportunity where hospitals can pay in installments to get supplies of equipment. Oh, we need the MRI machine in this particular healthcare facility, and we cannot afford paying it at once. Oh, let's pay 30%, and we start paying at certain period every 30 days, weekly, or would be remitting. I mean, something like that is also an investment opportunity for those that are seeing it the way I'm saying it.
Yes, and fortunately for us, we are in a time where technology is, at the forefront of everything that we do, and even in the healthcare area. Okay, and even in the healthcare sector, technology is also driving innovation. For example, 3D printing is being used to create affordable prosthetics and even medical tools. Imagine the impact of scaling such solutions across Africa. All right, Mubarak, let's share some practical tips for our listeners who are considering investment in Africa's healthcare sector. What's the first thing that they should keep in mind?
Well, I've always said it over and over again. Always do your homework. The healthcare landscape in Africa varies widely from country to country. For example, Ghana might be a great market for pharmaceutical manufacturing, while Rwanda is better suited for digital health solutions. Take your time to understand the local needs, regulations, and market dynamics before investing $1. Understand your community, understand your locality, understand where you are putting your money, what makes them tick, what policies can affect your investment. Do your homework.
Yes, that's very important, Mubarak. Like we've always mentioned, you need to engage with the locality, with the community where you want to be profiling your solution. You need to be able to identify the specific need in that community, and how your solution will be accessible. It's very, very important. And the second step is to focus on partnerships. You can't just come and say, oh, you want to invest and you are willing to do it all by yourself. Of course, you're doing it all by yourself, but you also need, you need people, you need the support from the government, you need support from NGOs, from local businesses, from partnerships that are crucial for navigating the complexities of Africa's healthcare system. For example, the AMREF Health Africa organization works closely with private sector investors to implement healthcare programs. So, for example, you are a pharmaceutical company that is coming to Africa, you're bringing in some new variants of drugs, vaccines, and the like. You collaborate with organizations, non-governmental organizations, to help you distribute these products to underserved communities, to communities where they'll actually be needed.
I'm talking about partnership. Yeah, did you know that you can also your businesses, your investment, or your anything you're doing at the moment can get a wider reach if you partner with Invest Africa Group Podcast. We can make sure that people across the world get to know your product by just sending us a DM. We'll tell you how we will go about it and how your product can reach a wider audience. Now, tip number 3, think long term. Healthcare investment is not Ponzi scheme. Healthcare investment is not a one-time investment and you get your return immediately. Always think long term. Healthcare investment often take time to yield returns, but the social and economic impact makes it worth it. Focus on projects that are sustainable and can scale over time.
Yes, that's the correct. And finally, we've always been talking about impact-oriented solutions. We've always talked about our impact. Any kind of investment that you can making you need to first make sure that it's impactful, and that's where there'll be unstoppable return on your investment. Look for impact first opportunities. One of the biggest advantages of investing in healthcare is that it gives you the ability to actually make a difference, whether it's saving lives or improving quality of care or just empowering the community. The impact you create will resonate far beyond financial returns.
At the end of it all, you ask me, why does healthcare investment matters? Well, the only answer I'll give to you is that investing in healthcare isn't just about making money. It's about contributing to healthier and more prosperous Africa. I'll repeat again, health is wealth. The returns are financial, social, and most times deeply personal.
I couldn't agree more, Mubarak. For our listeners out there, whether you're an established investor or you're just starting out, the healthcare sector offers opportunities to be part of something bigger. And as we've seen and heard, the time to invest is now. As we say today, healthcare in Africa is at a turning point. While challenges remain, the opportunities for innovation and impactful investments are immense. But what's your biggest takeaway from today's discussion?
Well, I think I just said it earlier that health is wealth, both for individuals and economies. Investing in health innovation isn't just about making money, it's about building healthier and more prosperous Africa. And the stories of Ghana and Egypt have proven that progress is possible with the right mix of innovation, collaboration, and funding.
Yes, absolutely. So for our listeners, once again, whether you're an entrepreneur, an investor, or you're just someone passionate about Africa's future, this is a chance to get involved. The health sector is one of the most impactful spaces to invest in right now, and you can be part of this transformation.
Well said, Awa. And on that note, we'll be wrapping up this week's episode of Invest Africa Group Podcast. Thank you so much for joining us. Don't forget to subscribe so you don't miss our next conversation. Until next time, keep investing in Africa's future. My name is Mubarak Abimbola.
Okay, and Hawa Adejite, everyone. See you next time and keep being healthy. Bye.